Rufus boy, let me love boy, what you know. Rufus boy, let me love boy, what you know.
Happy
Hello.
Wednesday. Tuesday?
Wednesday.
Happy Wednesday,
Hello.
guys.
We just had a packed day.
Yeah, very
I don't
busy
know
morning.
if we've ever mentioned it, but we live in New England, and the snow has been really messing up our school schedule and clinical schedule.
So we have a lot of makeups.
Yeah, today
It's
we
up
had.
there. So
No,
just
I
try
don't
to.
do this one.
Oh, I forgot. My memory's trash.
Yeah, I know. So we've had to do a double lab today. So we were there from 8 to 12, and we did. What did we do, Tess?
Okay, so first we did blood transfusions. So what I learned today is when the only thing you can run your blood with is normal saline. So you prep your normal saline first. So you prime it and you hang it, and then you go to your patient, introduce yourself. Well, you have already done that. You already washed your hands, you gloved your hands, and then you explain the procedure. And also, they're able to say no, like they don't want it, which I thought was interesting. I don't know. I mean, I guess they can say no for anything.
Yeah, really.
But yeah, so you explain the procedure. You get like informative consent, which is obviously just explaining, and then the blood guy comes in and and he explains, to confirm that it's the correct blood, because you can kill someone by giving them the wrong blood, and then right, that would be really bad. And then you hang that blood. And then the other thing she told us is about the extra normal saline. So in case they're having a reaction to the saline, to the blood, you would immediately stop the blood transfusion, and then already have that extra normal saline to switch out the IV. If that makes sense. Did you learn anything that I didn't say?
We learned the different types of allergic reactions that can happen.
Yeah, there are a
to
lot.
blood. And yeah, hopefully maybe we can try to get a video of us explaining, because I feel like it's hard if you don't know how IV tubing and Y tubing works.
For sure.
It probably doesn't make sense why you have to switch out the tubing before you put normal saline, but hopefully we can get a video of that so I can explain to everyone better. But
yeah, we're gonna ask permission to see if we can vlog in an open lab, so that way we can actually show you, make it more fun, more real. Try to go in the and then, so what was our next lab, Samantha?
Our next lab was Foley catheters, and we practiced putting the catheters in. That was interesting. And yeah, should we explain
That's
it?
pretty cool.
Everyone know how?
Yeah, I mean,
Okay, so
catheter.
Catheterization is a sterile procedure, which means you want to use aseptic technique. Yes, and follow your sterile field. So what you do is you get your box, you open it up, and you want to prep everything the best you can. And obviously you need to, all right, go. Sorry. You want to prep everything the best you can prior to opening up, and then you want to clean your patient's genital area, and then you want to lube it, put it in, inflate the balloon, give it a little tug to make sure it's not going to come out, and you're all set. But obviously it's way different, so if we can do video, then we will do it.
For sure.
Because
And
it could help all of us.
it should, for sure. It'll be fun too.
Anyway, I'm sorry.
And then a
like
key
to keep
point of like catheters is for the male, you're going in a circular motion for the cleaning, and then you do one circular, throw that out, get a whole new one with the iodine, and circular, throw it out. And then for the female, you're doing like quadrants. You use one cotton or whatever that they have. We had like a Q-tip, but in the hospital I guess it's like cotton with iodine.
Really? And
Yeah,
it has the tweezers?
with the tweezers. So you would like wipe one section, throw it out, wipe another section, throw it out, wipe another section, throw it out. But yeah, hopefully we can do a lab and show you. It's the next right turn, okay?
The next right turn?
Yeah, this right turn right here.
Okay.
So we're gonna grab food, and then we have lab today, but hopefully not, because it's gonna snow really bad. There's a snowstorm. Clinical. Or clinical.
Yeah, another snowstorm. That's gonna.
It's wild. First day of spring was yesterday. Like what?
That's ridiculous. So don't move to Massachusetts.
Yeah. But you get paid a lot here.
That's true.
Side note, like
if you could see all the snow on the ground still,
yeah,
like
it's crazy.
It's
I'm
ridiculous.
definitely gonna show you. Oh my
Are
God,
you
push over.
serious?
People are like,
I hate. I'm not even gonna say.
yeah,
I'm
no,
not gonna
they
say
drive
where
like
we live.
assholes around here. Like, anyways, oh my God, I know him, Will. So yeah, we're gonna grab food and then we're gonna make a study video later. I don't know if we're gonna put in the vlog or we're gonna do it separate. Maybe we should just put in the vlog.
Yeah,
I don't know.
Why not?
We'll see. We'll make a
see.
decision.
Because we have an exam coming up. So I don't know if we mentioned, but we were on break prior to this week, and it's Wednesday. So we just came back to school after a week off on Monday, and we have Monday, and we have we started a new like unit. And so we have our exam not this coming Thursday, but the next Thursday. So about like a week and a day away. And so we're starting to prep for that. Well, we already started.
It's literally a week because it's Wednesday.
Yeah. Well, we have clinical Monday and Wednesday, so we really only have a few days.
Go around.
This way?
No, just go.
Okay.
This
This is where your brother lives, right?
Yeah, they're moving.
Oh, that's right. When are they moving?
Yeah. April, I think. And then you're gonna take this here and take this left.
Okay.
All right. So holla back. Peace out. Deuces. We'll see you on the other side. Banking on not going, but it looks like we're going.
Too bad.
Looks like we are
We
going.
texted our instructor like, so, are we going? She's like, yeah.
About
We're like,
clinical.
oh, okay. Okay, I guess so.
So I guess we're going. It's gonna come up. We always miss the freaking exit.
1 mile.
We always miss it. How do you know?
Because it said.
Oh, literally
sign.
always miss the exit. Always.
The sign told me.
The sign. What we should. So yeah, we going. We're honestly might leave early, and then hopefully we can go back to the school and study for a couple hours.
Hopefully. I mean,
Hopefully, Samantha lives pretty far, so I don't want her to have trouble. But we'll see. We shall see.
whatever.
Alright.
Okay, I did it the right time this time.
Yeah, you did for once.
The fuck? Did you just say me?
Yes, I did.
Where do you know? Baby, trust me. I am gonna be your body like
We're so early.
We just got out.
We got out early. You can see it's light out.
Yeah,
Glorious,
for
praise the
once.
Lord.
It's because of the snowstorm, so
Yeah, our school canceled, so that means that we have to leave clinical.
yes,
So
yes, safety, you know. All right, so we're about to head to school. Samantha's gonna decide if she's gonna stay or not because she lives further. So we'll see.
we need to study more.
Mm-hmm.
And you know what I just thought of?
What?
When the school closes, the library closes.
No.
Remember when they're like, we're closing soon? Remember when that happened?
No.
You don't remember?
I do remember, but maybe there's an exception. Let's check.
Be like, excuse me. Excuse me.
That's so ridiculous. I mean,
Yes.
people live there. That's why I think it's ridiculous. Because people
Because
live
they can
there.
go live in their dorm. Maybe that different building will be open.
Yes.
Okay.
Let's try it. What if we
Alright,
get
well-
locked inside? Whatevs. We'll see. We'll let you know if we make it home.
We'll be on time. But yeah, so we had an interesting day. Tess, what was your patient like?
Oh, yeah. So my patient, he was an older man. He was about 84. He was admitted for sepsis. And when I got there, he was stable, alert, awake. However, his heart rate was so increased, he was tachycardic. He was 135. He was supposed to get discharged today, but because of his heart rate, he was not. So he's being monitored. So while I was there, he got his insulin, he got his blood glucose, which was pretty high, and then just took a bunch of vitals. And I left him sleeping, so he's pretty comfortable. How was your patient?
He was good. He was a larger man who had
400.
some issues, 400 pounds. He had some issues revolving his heart. He had CHF.
Mm-hmm.
He had PVD, which is like a venous disease. He had, what else? He had diabetes. He had high
Lots of
cholesterol,
edema
so much
on
edema.
his foot, like
his ankles.
pitting edema.
Yeah, so we had those wrapped up with the socks and hopefully, I don't know.
Hopefully he gets better.
Hopefully
We
he's
saw
okay.
him while we were there.
He's been
On
there a few
Tuesday,
days. Yeah,
yeah.
he's been there since the 18th. I think.
So hopefully he gets to go home soon. He's a really nice guy. Both our patients were really nice guys.
Mm-hmm.
Love those good patients.
Yes. They're not screaming at you.
Yes.
Get out of my room.
All right, so we're gonna head out and get back into town and see what's next.
I'm going now. Bye.
Bye.